Hi, my name is Samuel Bellamy, and this is my presentation on the career paths in the healthcare industry. I am feeling a little under the weather, so I hope I can get through this without all the extra coughing and things like that. You may have heard that the healthcare industry is probably the most in demand career path that a person can take because there's always a demand for medical services. Working in the healthcare industry is as close to guaranteeing yourself a job and keeping a job as you can get. Over the next couple slides, I'll be sharing some of the career paths, some of the jobs that you can look into if you're looking to get into the healthcare industry. The first thing that you need to know before looking for a job in the healthcare industry is determining if you want to work in a clinical or non-clinical setting. The difference between a clinical and non-clinical medical job is pretty simple. Just because you see the term clinical doesn't mean that you actually work in a clinic or a hospital. Clinical and non-clinical really refer to whether or not you provide direct patient care or not. A clinical job is somebody who is like a nurse or a physician or an allied health professional who provides that direct care to a patient. A non-clinical medical job is a behind-the-scenes person. They're the ones who kind of keep the hospital running. They could be your hospital executives or your transcriptionists or your medical billers or coders. A non-clinical healthcare position in the healthcare industry can look like a healthcare administrator who pretty much focuses on the ins and the outs of the healthcare system or the hospital that they're working in. They typically hold a master's degree, and they're basically for individuals who are organized, driven, and have a lot of knowledge about the healthcare industry. You can also choose to be a healthcare educator. A health educator teaches people about the behaviors that promote health and wellness. They typically work in a hospital or a nonprofit organization, and they could work in a government office or even a doctor's office. They typically need a bachelor's degree, and some health educators, some employers require that their health educators be certified and have an additional credential on top of their bachelor's degree. A medical transcriptionist is also another example of a non-clinical healthcare position that one can obtain. Their essential function is to listen to voice recordings that physicians and other healthcare workers make and then convert them into a written report. They have to have a strong understanding of medical terminology, anatomy and physiology, and grammar. And they typically do need some sort of post-secondary education. Allied health professionals are another path that one can go on when they're looking for a healthcare position. These are professionals who work directly with patients, providing direct patient care. A audiologist is someone who studies and deals with the hearing or the hearing loss of a patient. They identify and assess hearing and balance problems within a patient, and they typically need advanced education and work in a clinical or a hospital setting. An occupational therapist is someone who helps people recover from injuries or disability or a illness that prevents them from doing day-to-day activities, such as getting dressed or walking to the mailbox or putting on your shoes. And they also require advanced training as well as a 2-year degree. A physician assistant are PAs. They're medical providers who are licensed to diagnose and treat diseases and illnesses, and they can also prescribe medications to patients. They typically model their education after a physician, and they can treat patients within a physician-PA relationship. So basically, under the guidance of a actual physician, PAs can do work. A dental hygienist is someone who focuses on the oral health of your teeth. They typically require a 2-year um, a 2-year degree, as well as specialized training. They, excuse me. Then you have a speech language pathologist. This is someone who studies human communication. They also require a 2 to 4 year degree, and they work with a full range of human communication disorders. They also evaluate and diagnose speech, language, and other swallowing disorders. Physical therapy professionals work closely with patients of all ages to help them recover from and maintain a wide variety of physical aptitudes. These are individuals that, let's say, if you broke an arm or a leg, you would likely see a physical therapist to help you regain full control and strength back in that particular body part. Physical therapists do require advanced degrees, and all of these allied health professions require a great deal of personal skill and education. The last set of professions that you could possibly look into are your LPN, RN, and NPs, or your nurse practitioners. LPN stands for Licensed Practical Nurse, and those LPN programs usually take a little over a year to complete. Their scope of practice does vary based on the setting that they work in. You can work in a hospital or you can be in a clinic. In order to be an RN, you do have to have a 4-year bachelor's degree or a 2-year associate's degree, but you must pass the NCLEX and excuse me, you must pass the NCLEX in order to be any type of nurse, whether it's an LPN, RN, or a nurse practitioner. Nurse practitioners are more advanced nurses, and they typically have a master's degree. And they are nurses who can work independently of an actual physician. They can diagnose and treat illnesses, whereas the registered nurse and the LPN would not be able to do that. These are just a few examples of career paths that you can choose in the healthcare industry. I hope you excuse me. I hope you choose a career that works best for you and your skill set. And this concludes my presentation on careers in the healthcare industry. Thank you.